We're back. Dr. Jerry Cuomo here in Boca Raton, private practice. We're looking at now the impression of this tissue level case. And we noticed, microscopically, there's some things that you can tell right away. When you take an impression out, it's almost impossible to pull an impression straight out. So you're going to see some physical changes to the plastic, and that's just the way it is. I'm just going to lower this a little bit. Physical changes that occur, and I'll point them out internally, not necessarily externally, but you look around the rim and you find out, well, there's a little bit of deformity here and here, but that's you're going to get that. These are not made of metal. And so we're not in a perfect world, but it's going to be very, very close, if not negligible, to find. Now, the analog basically looks like this. Let's show you what that is. Here's your synocta, because we're at tissue level, and we're going to make a custom abutment. So here is your analog with its own serial number from Straumann, and we'll physically examine the internal aspect. And when they say synocta, there's an octagon internally, and you can see how pristine that is. Now this rim is going to snap into that plastic component, so we're going to go ahead and find the plastic. Now we can line that up properly with its counterpart. Twist it a little bit left, a little bit right. Make sure we don't trap anything. See how that little frimroll right there wants to trap. Maybe it's a good idea to get rid of that first. So let's see if we can do it with an Explorer. And we'll raise the magnification up a little bit more. This flash is going to get in our way. We don't need it. And we'll get rid of that. Now we're checking for any air voids. Okay, that's good. A little bit of saliva here. I'm not worried about that bubbling. The key here is contact, flat, no voids here. Contact, flat, no voids there. So you got a nice impression to be pouring up. It's a full arch impression. We highly advise full arch impressions for implants. Important to get the association. And notice we also injected into the occlusal surfaces to get this impression. Even with that, we still have a little void right here. So a little bit of air got in there. So we'll let the lab know that we'll have to get them to adjust the model a little bit. Okay, so we're back at it. We have our component. Now we're going to go ahead and twist left, right, make sure it bottoms out, which it does. Now it doesn't move, so then you just snap straight in like that. And we know that that's not entrapping anything. So now they'll pour this impression, and we'll mount the case, and we'll have now the analog in the right position, ready for a custom abutment. Now the custom abutment is going to be made from these components. This is the Straumann ESWN, or wide neck synocta pillar. Basically it's their wax sleeve UCLA abutment, and it's for the single tooth abutment. So you're going to notice there is also a countersinking octagon, so that anti-rotational, so it doesn't spin. The margin is in metal. They'll do a cast to there. They'll wax that up, cast to it, trim it, and customize it. This is the screw, the implant screw, made of titanium. That'll stay permanently in the mouth. We like to give them a lab screw and not touch this one, so that it becomes more of a pristine screw when it goes in. So we give them a lab screw to play around with, and then we keep this one pristine, so when it goes in, it threads one time in there. And that's you take a screw on and off, and John knows this because he's in the engineering world. Sometimes those threads can strip a little bit, or they get a little fatigued, so we like to keep that one separate. All right, that's about it. Let's move ahead now with John, and let's get him taken care of. And so we're going to use the vacuum again. This is a special vacuum that we've designed for this office. It's the 20 gauge hollow tip from Ultradent. The dental assistant right now, she's already got the healing abutment all cleaned, and we usually use peroxide for that. Peroxide works pretty well, releases oxygen. And internally, we're concerning ourselves with the internal aspect of the implant body. I want to make sure that there's no debris resting in there, no saliva. Remnants of the antibiotic that's used, antibiotic gel, is still within the inside. And that's about it. We can then see right to the base of the implant itself. And there's no debris. Alright. Okay, we're ready for that. Okay, get rid of my finger. Okay, so here's the assembly. Healing abutment. Snapped on like this. We're moving right on over here. And we're going to just line it up first. Always line it up first. Oh, turn to your left, John. Cotton plier. Got it. Okay. Yep. Probably should have a little piece of floss attached to this. Next time I will. For now, let's line it up again. We get that in place. I'll put my finger on the top of the wrench, and I just felt it engage the threads. Or did I? This is good to observe this technique here. Let's see if we can start the. Sometimes I won't use the wrench. I'll just come in and we'll do a hand tighten first. Let's do that. It might be a little easier for everybody. Okay. Retract. Retract the lip, please. Lip retraction, please. Right. A little bit further out. No, John, my fingers can't fit in between, so we got to use the wrench. Okay, here we go.
If you could open just a little bit more, great, perfect.
Well, okay. A little bit of a struggle there, but we'll get through it. Okay, let me find out where we are. You okay? Alright. Oh, sorry about that. Got it? Okay, I got it. Let me have a piece of floss. Okay. We're going to tie a little piece of floss around this. I'm fumbling it a little too many times. So. Okay, let's get that wrapped in here. Now, Straumann doesn't put a hole in this, so you've got to kind of tie this thing yourself. And I'll lasso it, and then we'll tie it. Let me get it over on a surface. And I can do this. There we go. Just I get the first knot done. The rest of it will go easy. There we go. There we go. Other companies have a little hole in their wrench, which works for them. Okay, so we'll take a pair of scissors and we'll snip this. What else can we do, right? Now we've got a nice long string attached to it. Everybody's heart beats regular again. So here we go. Your side. Back at it. The finale. Retracting a little on the lip, please. A little bit, not a lot. Okay, I'm getting in here, guys. Good to watch this. Here we go. I don't know if you could see that. Okay, here we go. All right. Looks good. Out, please. Looks good. Now, John, I'm going to tighten it a little bit, so I'm going to use a wrench. And we're just going to tighten it maybe 10 newtons. Up that, just a little bit. There we go. Just wanted to make sure it stays in place. Okay. All right, guys, we're done. We just have to take a color or shade. We'll do that. You don't need to watch it. Hope you enjoyed these video clips. John, did you enjoy it?
Oh, I enjoyed it.
Okay, there you have it from the patient. All right, Dr. Jerry Cuomo. Sorry it was a little long one, but we're happy to come back at you next appointment. We'll show you how we seat the crown. Next visit. Take care.